All right, today we're going to tackle a topic that can be really tough to talk about, but it's so important: buried penis. Look, this is a medical condition, plain and simple, not a personal issue. And the best part? It's highly treatable. So let's just dive in and break down what it is, what's behind it, and what the path to a solution really looks like.
So, what exactly is a buried penis? The number one thing to get straight is that this has nothing to do with the size of the penis itself. It's almost always a normal size. It's all about visibility. The penis is there, but it gets hidden or, buried by the skin and fat around it. This can be something a person is born with, or it can be something that develops later on in life. Okay, so for our first section, let's define the condition. And the key thing to remember here is that it's all about concealment, not size. Now, this is probably the biggest point of confusion, so let's clear it up right now. A buried penis is absolutely not the same thing as a micropenis. With a buried penis, you've got a normal-sized penis that's just hidden. A micropenis, on the other hand, is totally visible, but it's anatomically smaller than average. See the difference? It's a fundamental one. One's about the surrounding tissue, and the other is about the penis itself. So you might be wondering, how common is this? Well, getting exact numbers for adults is tricky, but one study in Japan found it in less than 4% of newborn boys. But, and this is really important to remember, this isn't just a condition people are born with. It can definitely develop later in life too. All right, section 2, the why. Let's get into the causes and the complications. So what actually leads to this, and what kind of problems does it really create for someone? It turns out there isn't just one single cause. For adults, the biggest factor by far is morbid obesity. That excess fat in the pubic area can literally just hide the penis. But other things can be at play too. Things like lymphedema, that's a kind of swelling from lymph fluid, or even scar tissue from a past surgery or a complicated circumcision. And the impact here, man, it goes in two totally different but equally serious directions. Physically, you're dealing with very real, practical problems, like trouble urinating while standing up or maintaining hygiene, which can cause some nasty infections. But the psychological toll is just as heavy. We're talking about crushing low self-esteem, anxiety, and huge challenges with sexual intimacy. And now for the turning point. Section 3, the path to treatment. This is the hopeful part, because this condition is absolutely treatable, and the road to a solution is often way clearer than you might think. Before we jump into the actual treatments, this is so important to talk about. This quote from the Cleveland Clinic just says it perfectly. It's not a moral failure or a reflection of you as a person or parent. This is a medical issue, full stop. Getting help isn't a sign of weakness, it's a sign of strength. So how does someone even get diagnosed? Well, it's usually a pretty simple 3-step journey. It starts with seeing a specialist, like a urologist. They'll go over your medical history, and then they'll do a physical exam. And here's something that might bring a huge sigh of relief. The diagnosis is almost always confirmed with just a simple physical exam. That's it. Usually there's no need for complex scans or invasive tests. That alone can take a whole lot of anxiety out of the process. A lot of times, the first step in treatment isn't surgery at all. If the cause is related to weight, a medically supervised weight loss plan can sometimes solve the problem completely. This is often paired with psychological counseling to tackle the self-esteem issues and, of course, antibiotics to clear up any infections. Now, when those non-surgical approaches aren't enough, surgery is a very effective solution. There are a few different procedures. A panniculectomy removes that overhanging apron of skin and fat. An escharnonectomy is a bit more targeted. It removes the fat pad right above the pubic bone. And sometimes skin grafts are used to make sure the penis shaft is properly covered after it's been revealed. And that brings us to the final section, recovery and outlook. So what happens after treatment? Let's take a look at the resolution. The results here are honestly life-changing. Successful treatment can completely restore urinary and sexual function. It makes hygiene simple again, and it delivers a massive boost to self-esteem and overall quality of life. The success rates for these surgeries are really high. But there's a really crucial point for long-term success. You've got to address the root cause. Especially for cases that develop in adulthood, keeping a healthy weight and lifestyle after treatment is absolutely key to making sure the condition doesn't come back. So we'll just leave you with this question. At the end of the day, a buried penis is a medical condition, not some kind of personal failing. The more we can have these clear, judgment-free conversations about it, the more we can chip away at that stigma and help people get the treatment that can truly change their lives.
Thanks for tuning in.